Welcome to Mercy Hospitals Total Joint Program. At Mercy Hospitals, we provide a comprehensive program designed especially for the joint replacement patient and their loved ones. Our goal is to make you an active partner in your treatment, to know what to expect during the pre-surgical period, intraoperatively, and postoperatively, all the way through discharge and follow-up with your doctor. We believe that you play a key role in the success of your surgery and invite you to become an active participant in your care. This class is your first step. Objectives and topics to be discussed today. You will be introduced to your joint care team. We want our patients to understand pre-surgery instructions and educations. We will review the day of surgery instructions and education. We want our patients to understand the hospital stay education. We want you to understand pain management instructions and education. Patients should understand physical therapy program instructions and education. Patients should understand discharge planning and education. Also, we will provide a way to answer your questions to ensure you have learned what to expect and how to be successful in your journey through your total knee, total hip replacement surgery and recovery. See total joint replacement, you and your coach or coaches. This is designed to allow patients increased walking. It is not a replacement for physical therapists or nursing care. A coach is a loved one who will be present in the hospital during and after surgery. In order to be a coach, you must review this education together. Be present for the follow-up visit with the surgeon. Be present for the initial physical therapy visit. Be present for subsequent treatments. We encourage patients to have more than one coach. Being a coach is important and can be time-consuming. Oftentimes, patients may need more than one coach to ensure that they're supported and cared for all the way through recovery. Your total joint care team. Surgeons, your surgeon, physician assistants, nurses, care coordinators, and your total joint program coordinator and physical therapist specializing in your joint care. Every detail of your care will be reviewed with you. Your joint care team will guide you through the process from pre-surgery to discharge. Testing, PAT appointments. You will receive a call from the hospital PAT department to schedule your PAT appointment. You will meet with a nurse at the hospital. The nurse will go over your medical history, instructions for day of surgery, and will provide patient education. You may bring your advanced healthcare directive with you if you have one. If you do not have an advanced healthcare directive and want more information, you can go to the website listed below. Surgical instructions. Emmy Multimedia Education. Emmy is a series of free online programs that walk you through the important information about a health topic, condition, or procedure that is prescribed by your surgeon as part of your care plan. We want you to understand and feel comfortable about your procedure, and this will answer many of the questions that you may have. You can watch Emmy programs as many times as you like, and you can share them with your family, friends, and your coach. You will be sent a link and access code via telephone, email, text to your education videos. Please watch these videos as soon as possible to ensure that you get all your questions answered before your surgery. You will receive a card with the QR code on it when you come to your PAT appointment. You can scan the QR code and watch the videos on your phone. You can share the access code with your family and your coach so they can view the educational videos as well. If you are scheduled to have a total knee replacement procedure, your QR code will take you to the videos about knee replacement surgery and anesthesia for the surgery. If you're scheduled for a total hip replacement, your videos and your QR code will take you to videos about hip replacement and anesthesia services. To complete a preoperative functional assessment. This assessment is required by the Centers for Medicare and Medicaid Services. This assessment includes very important information for your doctor to know. The email will come from the address listed below and will have your doctor's name preceding it. For example, if you are Dr. Srivastava's patient, the email will come from Dr. Srivastava preceding the email. If your doctor is Dr. Kapola or Dr. Hashimi, your email will come from Dr. Kapola or Dr. Hashimi. This link is safe and it is not spam or a scam. Some of our patients have been worried that maybe they shouldn't click on the link. This email is safe. Just click the link provided in the email and complete the assessment. If you are Spanish speaking, the questions will be in Spanish. If you need help with completing your assessment, I will provide contact information at the end of this video. Surgical instructions. You will be given a surgical prep kit prior to surgery at your PAT appointment. The kit will include solution and instructions on how to use it the day before and the morning of your surgery. Shower with the chlorhexidine Dynahex soap scrub the evening before surgery and again the morning of surgery. Showering with this soap will decrease the chance of developing an infection at the surgical site. Medications. You may be instructed by your surgeon to take certain medications with a sip of water the morning of surgery. Your surgeon may ask you to stop taking certain medications like blood thinners a few days prior to surgery. Contact your surgeon's office for any medication questions. The night before surgery, do not eat or drink after midnight, the night prior to your surgery. That includes chewing gum and sucking on breath mints. However, you may brush your teeth. The day before surgery, you will receive a call before 5 p.m. from the hospital with the time you will need to arrive to the hospital prior to surgery. Prevention of constipation. Prior to surgery, it is important to maintain good bowel health. You can take a Dulcolax tablet over the counter if you get constipated. You should increase your water intake. You should increase fiber in your diet, and fiber meaning items such as food and or fruit and vegetables. And you should stay mobile to decrease the risk of constipation. What should you bring to the hospital? First and most important is a medication list with all the medications you are taking, including the medication name, dosage, frequency, purpose or reason that you take the medication, and the prescribing doctor. You should bring an overnight bag with toiletries in case you need to stay the night in the hospital. You should bring comfortable clothes. What to leave at home is personal medications, meaning you don't need to bring the actual medication bottles with you. As long as we have the list, that's fine. We don't need you to bring the actual bottle. You should leave at home jewelry, purses, wallets, and all valuables so that they will be safe. Day of surgery. When you arrive, please check in the front desk of the hospital. You will be given your check-in time the day before surgery. And remember, no makeup or lotions, remove contact lenses, remove all jewelry and piercings prior to coming to the hospital. On the day of surgery, nursing staff will collect your weight. They will have you change into a gown. They will apply antibacterial wipes to the surgical area. Again, this will be to prevent surgical site infections in your incision. They will collect vital signs. They will start an IV. They will review your chart and provide any teaching needed. They will verify your consent for the surgery. And you will also meet with your anesthesia provider and talk about this anesthesia that will happen on the day of surgery. Your surgeon will mark the site of the surgery on the affected leg. There will be an opportunity to ask questions. On the day of surgery, there will be a waiting area where your surgeon will come and update your family. Family and friends may wait in the family waiting room. When you are taken to the holding area for surgery, your family will be directed to the surgery waiting area. They will receive your PIN or personal identification number. Your PIN number is provided as a way to protect your privacy and identifies those you have designated to receive updates on your progress while in the hospital. Following your surgery, you will be moved to the post-anesthesia recovery room. A member of the hospital team will speak with you, your family, and friends. The recovery room nurse will be managing your care at this point. They will ask what your pain level is and if you are experiencing any nausea. Your nurse will provide medication accordingly. Many patients are scheduled to go home the same day of surgery. If you will be going home the same day of surgery, you will be in the recovery room area approximately 4 to 6 hours. Once you are deemed stable and have successfully completed physical therapy, taken some fluids, and a light snack, you can be discharged to home the same day with your coach and family. If you are scheduled to stay overnight, you will be in the recovery room for about an hour or so. Then you will be transferred to the inpatient unit. Ice therapy may be applied to your joint if ordered by your surgeon. If you're staying overnight, you will use your incentive spirometer 10 times per hour while awake with deep breathing and coughing. Staff will assist your personal hygiene needs. Plan to have the staff assist you to your chair for meals. Rotate your ankles and wiggle your toes while sitting and lying. Physical therapy will visit you the day of surgery and help you ambulate and walk. They may possibly visit you the day after until you are cleared to go home. May be used for your care. While in the hospital, you may have oxygen, A tube carrying oxygen may be placed in your nose during surgery, and it may be there when you wake up in the recovery room. Compression devices will be around your lower legs to assist in circulation. These are called SCDs or ankle pumps. These are to prevent blood clots in your lower legs. Continuous passive motion machines may be started for knee patients as prescribed by your surgeon. You may have a trapeze bar to pull up and assist you with moving in bed. Use your incentive spirometer 10 times an hour while awake with deep breathing and coughing to prevent postoperative pneumonia. Management. There are a number of different types of pain control methods available to keep you comfortable. We can use oral medications or pills, injections into the joint during surgery, which your physician would do, or intravenous medications, which the nurses would give to you. The aim of good pain control is to decrease the pain before it becomes intolerable. You'll be asked by your nurse to rate your pain scale of 0 to 10, with 10 being the worst pain you've ever had. Be verbal. Communicate with your nurses. Let them know if the pain medication is or is not effective in controlling your discomfort. This isn't the time to tough it out. Good pain control increases your mobility and speeds up your recovery. So again, please speak up if your pain is not at a point that is manageable and controlled. Goal is to increase your time up in the chair and mobility. Follow the appropriate precautions for your total joint surgery, and when you have met all the criteria for discharge, you will go home. Care coordination. Care coordination goals. Care coordination can help with discharge needs. They can improve coordination and efficiency in the patient's surgical experience, assess the patients for post-discharge needs, and assist establishing any services needed in transferring the patient from the hospital to your home. Care coordinators are sometimes referred to as case managers. Case managers are nurses who help patients transition to home. Instructions and assistive devices. Going home. Plan to have a family member stay with you the first few days after surgery so that you can get used to using your walker and walking with the surgery. You must have a front-wheeled walker prior to going home. Please talk with your doctor or his office staff about getting a walker. Be sure to talk with your doctor and his office staff or care coordination about the need for other assistive devices. Other devices could include those that you see at the bottom of your screen. The first one, number 1, is a portable commode. A portable commode is a toilet that could be placed other places besides in the bathroom. Some patients live in homes where bathrooms are smaller and may be more difficult to use your walker inside of there. We want you to keep your walker with you and in front of you. So if it's not possible to get your walker in your bathroom, you may need a portable commode to be placed in another room beside your bathroom. A toilet seat riser, which is in picture number 2, can also be very helpful. This is a toilet seat that you sit on top of your current toilet seat. This helps make it a little bit taller in case your toilet is too short with a knee surgery or a hip surgery. This will help you get used to sitting down and standing up and will help you until you're stronger. A shower chair is also very useful for patients to go home with. It sets in your shower and you can sit down while taking a shower rather than having to stand up and kind of balance. We don't want you to fall. So this can be a very good device to have at home also. Your walker should be a two-wheeled walker with front wheels only. No seat on the walker and no back wheels. You can see from the photos below that the walker that you should have is the picture in the far um, left of the screen where it says yes in green. That's a front-wheeled walker. You'll note that it has two wheels in the front and two legs in the back with just rubber stubs. This keeps you stable. The walkers that have four wheels are likely to, they could come out from under you or kind of run away with you. We don't want that to happen. So only the walker on the far left, which is a front-wheeled walker only, should you have. Sometimes when you're getting your walkers from the medical equipment companies, they may try to give you a four-wheeled walker. Maybe they don't understand or they got the order wrong, but we need to make sure that what they're giving you is a front-wheeled walker. So if they hand you a four-wheeled walker, please correct them and tell them you should have the front-wheeled walker, the two-wheeled walker only. And so they can correct that and make sure you get what you need. Incision care to avoid infection. Your incision should remain clean and dry. Do not immerse the incision site in water, such as a bath or hot tub, until cleared to do so by your surgeon. Do not put any creams, lotions, or ointments on your incision unless ordered by your surgeon. Avoid touching your incision and wash your hands frequently. Instructions continued. Medications. Have a plan to get your prescriptions filled prior to going home. When you're going home, once you get there, you need to have your pain medications with you. And take your medications as prescribed by your surgeon. Don't let your pain get too strong. Take pain medication regularly the first few days after surgery as needed. Pain medication can be constipating. Remember to increase your water intake, increase fiber-rich foods in your diet, and your surgeon may instruct you to take a stool softener to prevent constipation. If you have been prescribed a blood thinner for prevention of blood clots, remember to continue these per your surgeon's instructions. Instructions continued. Activity. Continue to increase your activity level as directed by your surgeon and physical therapist. Get up and move around during the day every 45 minutes to keep circulation going. You want to move as much as possible. Let your dentist and other physicians know that you have had a joint replacement surgery. You will need antibiotics prior to dental work and other surgical or invasive procedures. And more reminders, drink plenty of fluids. Staying hydrated helps you and your body heal. It also helps with constipation. Continue to perform ankle pumps and deep breathing exercises hourly while awake. Discharge instructions. Do not go to the emergency room for these conditions. Instead, call your surgeon's office if your bandage begins to come off. If you develop a fever, this could be a sign of infection. If your incision enlarges with redness, or if you notice an odor or drainage, this could be a sign of infection. If you see any changes in color, if you develop pain in the calf area, or if you notice swelling in your calf, ankle, or foot, do not go to the ER for these concerns without speaking to your surgeon first. Okay, so the doctor who did your surgery knows you, and he knows what kind of surgery you had. He knows what he did. This will help him to, if you call him, he can help you much more quickly and probably more effectively than going directly to the ER because he knows you. Sometimes he may have you come to his office where he can examine you, or he may decide we need to order a different prescription for you and treat you that way, which will be more comfortable for you and prevent you from having to make a trip to the emergency department. When to go to the emergency room. Now, there are times when you should go to the emergency room. And if you have any of the following symptoms, like number 1, chest pain. Number 2, severe shortness of breath, meaning you can't catch your breath. Not that you're tired and breathing from exertion, but very short of breath. Number 3, sudden severe pain in your joint that is not relieved by pain medication and rest. If you experience any of these 3 items, please call 911 and the ambulance will take you to the hospital. Please don't drive yourself to the hospital. That would not be safe. Therapy and movement leads to recovery. Physical therapy is an integral part of your postoperative care in the hospital. Early mobilization reduces complications and allows you to recover more quickly. Your active participation is key. Every treatment is focused on your return to normal function, so you gain the ability to be as independent as possible and return to your home safely. Please bring your walker when you are being discharged. If your walker, to ask your doctor if he or she wants you to have physical therapy after you go home. Most patients have been referred to surgery before surgery to have physical therapy appointments scheduled to take place a few days after they have surgery. Please be sure to ask your doctor about this before surgery. Some patients, if you are having a total hip surgery, you won't always have physical therapy scheduled. Now, you will still have physical therapy before you go home in the hospital to teach you and help you learn how to ambulate and walk with your walker. But it may not be necessary to have outpatient physical therapy for a total hip surgery. This depends on the approach that your physician took when doing the surgery. So ask your doctor about that for you. All patients who have total knee surgery replacement will have physical therapy. It's very important for knee patients. Ensuring that you understand and make sure that you, when you get your walker, that you get the front wheeled walker, which is correct. Therapy sessions. While in the hospital, you will have a physical therapy session before being discharged. The goal is for you to ambulate and walk the same day of surgery. The physical therapist will see you in your room. You should schedule pain medication to be taken prior to treatment. You will be instructed in your exercise program, which has been created to improve your functional mobility by increasing the range of motion and strength of your legs. Your precautions will be reviewed with you. You will increase your walking distance and activity. You will also learn stairs if needed, if you have stairs in your home, and you will be included in your exercise plan. Replacement precautions. You may or may not have hip precautions placed on you. Again, this depends on your surgeon and his approach. And he will tell you about that. If you will be instructed on specific mobility guidelines by the physical and occupational therapists. You will be expected to demonstrate the ability to apply all of these to your activities. Post-operative knee precautions. Do not pivot while standing. Don't twist your knee. Don't dangle weights on your legs. This would cause added stress. Do not place pillows under your knees. We do not want your knees at an acute angle. Follow proper transferring procedures when getting in and out of your car. Do not kneel, squat, or jump on your new knee until advised to do so by your doctor and physical therapist. Your home exercise program. The following exercises are important to perform before surgery and after surgery. It is important to be as strong as possible before surgery to help you in your recovery. The exercises will build strength and range of motion to aid in getting in and out of bed, standing up, and walking. Depending on the type of surgery and progression, the physical therapist will let you know which exercises will be appropriate for you to perform. Please do not add any other exercises to the routine unless instructed to do so. Ankle pumps. Bend your foot up and down at your ankle joint as shown in the slide. While lying or sitting with a small towel under your ankle, tighten your top thigh muscle to press the back of your knee downwards towards the ground. A glute set is lying on your back. Squeeze your buttocks together. Heel slides. Lying on your back with your knee straight, slide the affected heel towards your buttock as you bend your knee. Hold a gentle stretch in this position and then return to the original position. Leg rise. While laying or sitting, raise your leg with the straight knee. Keep the opposite knee bent with the foot planted on the ground. Seated heel slides. While in a seated position, with the foot forward and rested on the floor, slowly slide your foot closer towards you. Hold a gentle stretch and then return your foot forward to the original position. Arc quad. High seated, while seated with your feet in a bent position, slowly straighten your knee as you raise your foot upwards as shown in the slide. Going home. Consider the vehicle you will travel home in. You will be more comfortable getting into a sedan or a small SUV. We will practice safe transfer techniques and stair training with your coach or family. Remember, prior to discharge. For your safety, be sure to have your coach or support person stay with you for a couple of days while getting accustomed to your home and assistive devices. Remove all throw rugs from the kitchen, bathrooms, and entryways. These are fall hazards, and we do not want you to fall. Please also watch out for those mats and rugs that you'll see like at grocery stores or pharmacies or almost anywhere you go to a store. They always have those rubber mats that sometimes have like carpet on top. Be careful of those because it's very easy to get your wheels of your walker caught up in those. So Try to be mindful of that and pay attention to those. Place commonly used items at waist level in kitchens and bathrooms so you don't have to reach for them. Contain your pet on the day of your homecoming. They can sometimes be very excited to see you and jump on you and could knock you down. Use your assistive device, your walker, until your doctor or therapist instructs you otherwise. Do not drive until your surgeon gives you approval. Use your pain medication as prescribed so that you can move. Take your anticoagulant medications as directed by your physician to treat blood clots in your legs. Do your home exercise program 2 to 3 times a day. Ice frequently to reduce pain and swelling. Some further considerations to help you improve your healing. Nutrition is very important, especially for patients undergoing total joint replacement surgery. It's important to have a well-balanced diet. It's essential to your recovery and healing of your skin and your surgical wound. Specifically, increase foods high in omega-3 fatty acids. Some of those, for example, are salmon, um, oysters, spinach, eggs, um, and also remember to increase your intake of vegetables and whole grains. Activity and exercise is also very important to maintain a healthy weight prior to joint replacement surgery. Daily activity and exercise that is approved by your physician are essential to promoting good outcomes before and after surgery. Talk to your doctor about a healthy level of activity and exercise to reach and maintain a healthy weight and lifestyle. Tobacco use. While most people know that smoking is linked to heart and lung disease as well as to cancer, it also causes complications such as poor wound healing and infection and poor final outcomes of surgery. Smoking has a higher rate of complications after surgery than non-smokers. The nicotine in cigarettes and chewing tobacco can decrease the blood flow to areas of the bone and tendon that are trying to heal after surgery. If you are a smoker, please consider quitting. Reach out to your doctor for a smoking cessation program that is right for you. The American Lung Association is a great start. Alcohol's effects on orthopedic surgery outcomes. Alcohol dependence or abuse has been shown to have issues for total joint replacement surgery patients. They are 9 times more likely to have a longer hospital stay. They are 22 to 33% more likely to have a higher rate of complications. They are 23% more likely to require a blood transfusion and 15 times higher risk of postoperative infections. Since you are facing a joint replacement surgery, if you think you might drink too much, it's possible to have it pays to have an honest conversation with your orthopedic surgeon before you have surgery. Some of the options that can be included in part of your care is medications, more intensive monitoring for risk factors while you're hospitalized, and we can increase follow-up visits. We can increase how often you have them with your surgeon to help you get through the surgical process without drinking or drinking less alcohol. While talking about it with your doctor can be very uncomfortable, it's also very important to ensure you have less risk during and after your joint replacement so that you can recover more fully. Improve healing would include illicit drug use. Drugs such as opioids or heroin, Injecting these opioids can damage your superficial veins. They can make IV access difficult during surgery. It makes postoperative pain control challenging. It also suggests that opioid exposure is associated with reduced likelihood of healing in patients with chronic wounds. Stimulants such as cocaine, amphetamines, or methamphetamines, these drugs increase the risk of cardiac events and lung problems during surgery. Longtime users may need preoperative cardiac evaluations. Methamphetamine use has been specifically linked to higher rate of surgical site infections. Marijuana affects the central nervous system, potentially requiring higher doses of anesthesia and potentially causing decreased blood pressure and delayed walking from the procedure. Inhaled marijuana can also increase the risk of lung infection and exacerbate or make worse existing respiratory issues like asthma. Additionally, it may increase postoperative pain and the risk of developing opioid use disorder after surgery. Delayed healing, substances can compromise the immune system, increasing the risk of infection and delaying the healing of bones and wounds. Increased complications for chronic drug users may experience higher rates of respiratory, cardiovascular, and pain management complications. Patients with substance use disorders often require extended hospital stays, longer hospital stays, and more intensive postoperative care. If you think you have a substance abuse problem, speak with your doctor before surgery. You may benefit from counseling, detoxification, rehabilitation, and other forms of support to help you address substance abuse and improve surgical outcomes. Patients ask the question, will my artificial joint set off airport security metal detectors? And the answer is yes, but there are some things to know. Most commonly used orthopedic implants may set off metal detectors. Over 90% of implanted total hip and knee arthroplasty devices will set off airport metal detectors. Many implants now include ceramic and plastic materials in addition to metal, and the metal will still likely cause an alarm in the metal detectors. A card or a note from your physician is not needed for identification of these types of implants. Simply inform the TSA officer before screening begins that you've had a hip or knee replacement. Point to the location on your leg where you have the implant. Passengers can use TSA notification cards at the link below to communicate discreetly with the security officers if they prefer. Tell the TSA officer or showing this card will not exempt the passenger, you, from the screening. Instead, you will be instructed to go through the body scan machine. Many people prefer to be screened by the body scan or the X-ray machine to reduce the likelihood of a pat-down being necessary. If you prefer not to go through the body scan machine, you can opt for the pat-down. Even if you go through the body scan machine, the TSA officer may still need to pat the area around your joint. We recommend allowing additional time for airport screening when traveling with a joint replacement to help ensure a more pleasant travel experience. We have reached the end of our education presentation. I hope you have found this helpful. However, if you or your family members have questions after reviewing this important information, you may use one of the following options listed below. You may call your surgeon's office to ask the question. This option is always available to you. Or you may call or email your total joint program coordinator and ask your question. My name is Tracy Sherman, and I'm a registered nurse. I am the total joint program coordinator for Mercy Hospitals in Bakersfield. This includes Mercy Hospital downtown on Truxtun Avenue and Mercy Hospital Southwest on Old River Road. You may choose to either call me on the phone or leave me an email. Please leave a detailed message and I will call you back and I will respond to your emails. I will do this as soon as possible, I promise. We look forward to seeing you very soon. Goodbye.